Hi, Leah. Hi.
Hello.
Nice to chat with you in
Yes,
Wake
thanks for
Park.
having me.
You're from Wake Park, Minnesota, which is right outside of St. Cloud, a little northwest of Minneapolis for those around the country who are listening today. Um, Leah, you have a weight loss journey. I mean, we use that term a lot, especially when it comes to profile, but yours truly is a winding, twisting, turning journey. So I just want to jump right in and talk about how you feel this all started. And when you filled out our questionnaire, you wrote about your pregnancy, your first pregnancy 15 years ago. Your son's 14. So when you had that first pregnancy that you gained over 80 pounds, and that is not uncommon. I mean, women, we have no idea really how our bodies are going to react and how you do pregnancy, how you've got to do pregnancy. Do you feel like all of this kind of started on another level when you started having kids?
Oh, absolutely, it did. Yeah. I would say maybe my whole adult life, I had a very, kind of up and down battle, but never to the extent of gaining 85 pounds, which I did with that first pregnancy. Yeah.
And how many kids did you have?
I
Did
have
you
three.
You have three.
Yeah.
And so was you didn't gain 80, lose 80, then have another big one and lost. You kept some and then added to it, I'm guessing.
That is correct. In between my 14-year-old and my 12-year-old, I had a miscarriage. So, and then between my 12 and 11-year-old, I did. And so I pretty much spent a span of 5 years being pregnant, kept that weight on,
Mhm.
and added to it during that time. And so, yeah, it was kind of I would say that I've always been someone who's an emotional eater. And so going through the last pregnancies, having three very tiny children in the house,
Mhm.
that was a lot. And then adding to that, there was another element with my husband, because during that time he suffered a brain injury. Right after our third child was born, she was 4 months old and he had a brain injury. So he was in and out of the hospital for almost 8 months.
Mm.
He had to relearn to walk. He had problems talking. It was a lot. And then since then, his
Yeah.
medical issues have not gotten a whole lot better. He's now a double amputee. So
Okay.
I
So
yeah,
yeah, this is a lot. You're
it
dealing
is.
with a lot. And
It is.
for some people, just the three young kids, that's enough. And
Mhm.
that is real life for a lot of people. The last thing you think you're doing is I'm going to get healthy and I'm going to eat right. I'm going to cook all these wonderful foods because you're thinking, where can I get a nap? How can I keep my sanity? Like, and that is not trying to make light of a situation. That is real life. So
That is
how were you
absolutely.
managing and how far away was your health from your mind at that time?
I was the absolute lowest priority in my life. I came probably 10th in the line
Mm.
or the list of things that I had going on. It was the kids, it was my husband, it was his health problems, it was everything going on with the kids, it was work, it was because during this time I was also working full time. It was everything other than me. And so for, you know, over a decade, I didn't matter. And how my health was and how I was feeling, it was not something I even thought about at all.
So fast forward to the point where now your oldest son is 14 years old. And
Mhm.
you had said that this all was kind of triggered at a Christmas gathering of your family where you found out your sister had been doing profile and her, I think, cousin and husband. And so you're hearing all these things about profile, but you must have been ready to hear this information at this point too. What,
That's a very good point. I was ready. And the reason I think
what
I
got
was
you there?
finally ready is that in November, so in November of 2021, I had gone in for I'd finally gone to the doctor. I can't even remember how long before that I'd gone to the doctor. I didn't want to go to the doctor. I didn't want to step on a scale. I didn't want to be told, oh, you know, now you're diabetic. Or, I was so afraid to go in and see the doctor and be told, you've neglected yourself long enough. You have all these problems. And because we had so many things dealing with my husband. So I neglected it. And then finally, after he kind of browbeat me for a little bit, I did. I made an appointment. I went in. And that's when they found some lumps on one of my breasts, which was scary. But I thought, I don't know. I'll just see this through, see where this goes. And then it was questionable. and I had to go through a biopsy, and I was still waiting for results from the biopsy when I had Christmas with my sister. She walked up to the door. She was unrecognizable to me. Really? I looked at her and I'm like, wow, you look amazing, you know? And she's like, yeah, I joined Profile by Sanford. She lives in the Fargo-Moorhead area. She had lost almost 80 pounds. She looked phenomenal. And if you know anything about my sister can't stick with anything. I'm sorry. I love her to death. She can't stick with anything. She has tried every occupation known to man. She just like, she gets really excited about something, but she can't stick it out. And I love her. And she will admit that happens.
Mm-hmm.
And so I'm thinking, wow, this worked for her. And so I started digging and I started asking her questions about it. And she goes, an idiot could follow this. She's not an idiot, but her saying that to me kind of made me feel like, you know, maybe this is something I could do. I'd already kind of found that need inside of me to change my life, to do something for me and to get healthier. It wasn't about, I want to look better and I want to fit in this. And it was, I need to feel better. I need to be better. I wasn't yet diabetic, which is amazing because I was so heavily obese. And I thought, you know, it's only a matter of time. It's only a matter of time before all these things change. And so, yeah, talking to her. And previous to that, I have a cousin and her husband who live in the Alexandria area who had also done Profile and lost a combined weight of over 100 pounds together and had been keeping it off.
So the breast cancer scare, the hearing from your sister, hearing about another a cousin, was it that quick and it hit you like a ton of bricks? Like, this is where I'm headed. This is what I'm meant to hear. Or was there still?
It was definitely an impetus because after that conversation and then sitting and talking to my husband, who also, he knows that, yeah, I might be feeling this way, but am I actually going to take that plunge, like with the doctor appointment? Am I actually going to follow through, or is he going to make the appointment for me and say, you have to go? And he made the appointment. He said, well,
he made the appointment for you.
For both of us. Yeah.
For both of you. Okay.
Yeah. And I'm like, oh, okay. See how you work. And so I was already probably at like 65, 70% sure. Yes, I'm doing this. And then he made that appointment. We went in. And after that first initial meet, I'm like, yes, I'm all on board. Yeah.
What was it about that first initial meeting that secured it? Because it could have pushed you the other way.
It could have went the other way very easily. Yes. So, you know, they were so, I think maybe I should explain first before I go into this that I had kind of cocooned myself through the course of a decade. I used to be very outgoing and I loved to be social but I had become very like social anxiety and I didn't want to be around people because in my mind, I'm thinking they're looking at me and going, how did she let herself go like this? Oh my God, she's gotten so big. And like in my mind, kind of just closed in on myself. And it's a lot to go out and meet new people and sit in front of them and especially talking about all of this. And so sitting down in the office in front of, God love her, Emily is probably a size 0, 00. I mean, like there's nothing to her. And I'm thinking to myself, oh, this is going to be hard.
This is your coach you're talking about, Emily?
Yes. Okay. Yes. She was so down to earth and so welcoming. And before I even could verbalize it, had already addressed a couple of my fears and, you know, just laid it all out so nicely for me that I'm like, I can see how this can be easy if I follow the foods that you're given that you can eat and the meal plan. And it, to me in that meeting, it was like, I would be crazy not to do this. I would be crazy not to do this.
So you did it. You started.
I did. Yep. And I expected a lot more bumps along the way than there actually were. I don't know. Yeah, I did. I gave up caffeine within that first month, which I think I basically, my liquids ended up always being just, I would drink Diet Pop like water, which isn't great for you.
Not great.
I gave up. No, not great. I mean, it's better than I guess sugar pop, but it was not great. And I gave that up within that first month. You know, along the way, I think the biggest obstacle for me was we had taken a trip to Florida, and I thought over my birthday, and I thought this is going to be hard for me because we're away from home. I'm not controlling my environment. I'm
Mhm,
not
mhm.
making the food
Right.
myself.
Yep.
I'm like
Yep.
getting down there. How's that going to be? And we had such a great talk with our coach before we left, and she gave tips about what I could do for, along the way, what we could do when we're in restaurants,
Mhm.
just the things on menus. We even looked at menus before we went and stuff. It was great because this isn't stuff that they just are hearing now. I mean, they have the experience of going through this with other members, I'm sure. And I just felt a reassurance, like I'm not going to slide sideways and fall off of this. I'm going to be just fine. And I ended up losing 15 pounds on vacation.
Oh my gosh.
So, yeah.
That's must have been a long vacation. We're not talking about a
We were,
3-day
we were
weekend.
gone for a while, but yeah, it was. And I think after that little obstacle, the vacation, there really hasn't been obstacles since then. So
Because you've navigated them. You had the
yeah,
tools and the guidance and the education to be able to
exactly.
view it as
Yep.
actually not an obstacle, just
Hmm.
a situation. Yeah.
Exactly. Yeah.
You had written that you realized after some soul searching that you had used food as a comfort. W-
Oh,
How did you mean that, and
I did.
how did you get out of that?
Right. So I would say that I realized I was kind of seeking food for comfort when we were going through all the medical issues with my husband.
Mhm.
And maybe even at times when I was pregnant and I had another couple of little kids, it was just like, I'm going to sit down and have some ice cream. That's going to make me feel better. I don't know but I did
Yeah.
realize that was definitely going to be an obstacle for me. Some of the psychological, a big thing for me was distraction. And once I started distracting myself with something else, something that I'd always really wanted to pursue, and one of those things were writing, I would just spill all my icky emotions and everything I was feeling out on a page. And I mean, I worked through it. And I feel like I got that reassurance, maybe, or support from the coaching staff to realize that I could do that. And
Hmm.
so it became less about I'm seeking food for that comfort as just getting some of those uncomfortable or icky feelings out onto a page. So
And how, with the soda pop, Diet Coke, whatever it was in particular, did you
yeah.
just switch it with water and all is well? Or because
No,
when
actually
that's
I
been part of
didn't.
your life for a while, that is not
Right.
an easy change.
Yeah, I thought to myself, what I mean, I don't necessarily like just drinking water. If I'm working out, I definitely want that as opposed to something with some flavor in it. But
Yeah.
um I started drinking some Propel, which had a little flavor to it.
Mhm.
Um my sister had, when she was going through Profile, somebody that she was dealing with had suggested Zip Fizz. And
Okay.
so, and looking at it, it's kind of like a mineral and vitamin supplement, almost with a little bit of fizz to it, almost like the carbonation in
Sure.
pop.
Uh-huh.
So that was a good alternative, certainly limited to 1 or 2 a day. Yeah, but I found a replacement, and it seemed to work just fine for me.
Yeah, that's a big one.
Yeah,
Eliminating soda for a lot of people, no matter what shape or form, diet, regular, that is a big one. And to
right.
get enough water in your daily life. So, I actually want to go back to just clarify something because you had talked about your breast cancer scare, but you never told
Mhm.
us if
Oh,
you're
yes.
okay or healthy, or how did that end up?
Right. So they're watching one of the lumps, which they couldn't determine one way or another whether it was going to be benign or otherwise. So
Okay.
they're still monitoring it. It hasn't changed in the
Okay.
course of the year.
You are
So
aware of it. You are going to those doctor's
I
appointments,
am.
the
I
follow-ups.
I started
Okay.
going to the doctor on a regular basis. Imagine that.
And
I
you know,
don't cringe when I have to step on a scale.
and you had written that you're very well aware of how obesity contributes to all kinds of medical problems, including something like breast cancer, and just being healthy
Right.
overall is all part of it.
I would kind of argue most adults know that, and myself very much included in that. But I think that because I just really was not a priority in my own life for so long, I didn't let myself think about it or worry about it. And then once some of the other things in life started to settle down a little bit, and I kind of took a deep look at myself and knew I just didn't have energy. I didn't feel so great every day when I got up. I felt fatigued all the time. My social anxiety was, I'd go to work, I'd come home, and that was it. I didn't want to be out about with people and friends. And
Yep.
just, it was a combination of so many different things that I really had to go, like, I could have medical issues right now and don't know about it because I haven't gone to the doctor. And so, yeah.
Well, Leah, where are you right now? Are you still in reduce? Are you still actively
I am
losing weight?
still in reduce. I'm about 40 some pounds away from my goal weight. I have lost almost 140 pounds.
Oh my gosh.
January. Yeah.
Wow.
So super excited about that. And the biggest thing is that I noticed within 4 months, okay, I didn't feel so great before. You don't realize it until you start losing that weight. But 4 months into it, I had to acknowledge my energy level was up 50%. I felt like a new person. I felt so much better because I did not realize how much carrying all that weight around was doing to me.
You know, you had said when at Christmas, when your sister walked through the door, how incredible she looked. I bet you have gotten that reaction from people that you haven't seen in a while. How have people reacted to you?
I absolutely have. Obviously, on social media, I never ever post pictures of me, ever. It's the kids, it's my husband, it's never me. And recently, we had a family wedding, and I actually posted a picture of myself. And then there's a lot of people, obviously, on social media that don't live anywhere near me, that haven't seen me for a long, long time, probably haven't seen me since pictures of the kids when they were like 3-4 years ago. And there was quite a like, wow. Which I kind of figured I look more probably like myself now when they last saw me about 2 decades ago.
And how has your social outing, just the view of the world and being among people, how has that changed?
There's still a piece of my brain that needs to be worked on with that. I still walk into rooms and go, oh, no, but it's gotten so much better. I feel a lot more outgoing at work. I feel like I can put myself out there a little bit more. It's not as severe. I'm still working on it. It was a long time to develop it, but it's getting better.
Good. Sure. Your overall physical, mental well-being, I would assume, is in a much better place. And your kids must think you are a different human being physically and emotionally as well.
Right. I will never forget my 14-year-old coming up to me. He actually encouraged me at the beginning of this last January to take a before picture. He said, Mom, you got to take a before picture. And I'm like, oh, a picture of me. No, ick. But he made me do it. He took a picture of me. Then I think it was August or September. He said, you should do another picture. And so he did. But anyway, he'd come up to me a few months ago and gave me a big hug. And he's kind of teary-eyed. He goes, Mom, I'm really, really proud of you. Because that's really hard. He goes, I know that's got to be really hard for you to do what you've done. And you've done such a good job. And then, of course, that made me tear up. But, all of them have in their own ways expressed how happy they are for me. And then also how happy they are to see that I appear to be enjoying life a little bit more. So,
wonderful thing. Even the hug, even the physical act of you hugging your kids and them hugging you, because your body is so much smaller.
Yeah.
Just the hugs are different.
Yeah. Yep.
That's awesome. Wow, Leah, you're a success story, man. I feel like I want to just check in with you every couple of months and lift my spirits and cheer you along the way. Are you allowing yourself to be proud of yourself?
I think at first I was nervous to be proud of myself. I probably didn't really acknowledge until August that like I'm doing this. I am doing this. Nothing has pushed me astray. And I'm proud of the willpower I finally found somewhere. And I think at that point, then I was starting to be willing to give myself a little bit more credit than I had before that. Yeah, I'm proud of myself.
Good for you. Be proud of yourself.
Yeah.
It's a huge accomplishment what you've done. I know you're not there. You're not finished. There's
I'm not
more
quite there, but I'm going to get there. I'm so excited.
girl.
Yeah.
Girl. Keep going, Leah. Keep going. Congratulations on what you've done so far. And I 100% believe great things are in store for you. So congrats. Keep it up, girl.
Thank you so much. Thank you.
Wow. Leah Held from Waite Park, Minnesota. What a story. What an incredible journey that she's still on. Thanks for sharing your story. And thanks to all of you who have listened or watched this episode of Profiles in Health and Wellness.